Welcome to today's video. If you're preparing for the NCLEX, you're in the right place. In this video, we'll walk you through 25 practice questions covering a wide range of topics, including medical surgical nursing, pharmacology, pediatrics, maternity care, and mental health. These questions are designed to mimic the style and difficulty of the actual NCLEX exam, helping you build confidence and sharpen your critical thinking skills. Each question comes with detailed explanations, so you'll not only know the correct answer, but also understand the reasoning behind it. Whether you're studying for the first time or brushing up on your knowledge, this practice test is a great way to assess your readiness and identify areas where you might need more focus. So grab a notebook, stay focused, and let's dive into these 25 NCLEX-style questions together. Don't forget to pause the video if you need more time to think, and feel free to leave a comment if you have any questions. Let's get started. Question 1. The spouse of a client who sustained third-degree burns from a gasoline explosion asks the nurse, "What does third degree mean?" Which of the following is the correct explanation? A. The skin is red and painful to the touch. B. The burn involves only the outer layer of the skin. C. All skin layers and underlying tissues are injured. D. The skin has blisters and is pink or red. Correct answer. C. All skin layers and underlying tissues are injured. Explanation: third-degree burns, also known as full-thickness burns, damage all layers of the skin and may extend to underlying tissues. This results in significant tissue destruction and requires specialized medical care. Question 2. A client on fluid restrictions reports consuming 6 ounces of milk, 8 ounces of tea, and 4 ounces of sherbet. What is the client's total fluid intake? A. 16 ounces, B. 18 ounces, 14 onzas, D. 20 ounces. Correct answer, B. 18 ounces. Explanation: the total fluid intake is calculated by adding the liquid components, 6 ounces, milk, plus 8 ounces, tea, plus 4 ounces, sherbet, equals 18 ounces. Sherbet is considered a liquid at room temperature and contributes to fluid intake. Question 3. A parent brings their 6-year-old son to the clinic after the child has been ill for several days. The parent reports dark brown urine, fever, and swelling around the child's eyes and hands. Which medical history indicates post-streptococcal glomerulonephritis, PSGN? A. Recent ear infection. B. Sore throat 2 weeks ago. C. Family history of kidney disease. D. History of asthma. Correct answer, B. Sore throat 2 weeks ago. Explanation: post-streptococcal glomerulonephritis, PSGN, is a kidney condition that typically develops 1 to 2 weeks after a streptococcal infection, such as strep throat. Symptoms include dark urine, swelling, and fever. Question 4. A client with chest pain and dyspnea is receiving O2 via nasal cannula at 2 liters per minute. Which finding demands immediate nursing action? A. History of hypertension. B. Nausea and indigestion. C. Restlessness and anxiety. D. Pain on urination. Correct answer. C. Restlessness and anxiety. Explanation: restlessness and anxiety are signs of hypoxia, which may indicate inadequate oxygenation. This requires immediate intervention to prevent further complications. Question 5. A client in the ICU has a Swan-Ganz catheter in place. Which hemodynamic value is abnormal? A. Pulmonary capillary wedge pressure, PCWP, 8 millimeters of mercury. B. Cardiac output, 3 liters per minute. C. Central venous pressure, CVP, 4 millimeters of mercury. D. Pulse pressure, 50 millimeters of mercury. Correct answer, B. Cardiac output, 3 liters per minute. Explanation: a cardiac output of 3 liters per minute is below the normal range, 4 to 8 liters per minute, indicating reduced heart function and potential cardiac compromise. Question 6. A client with SARS-CoV-2, COVID-19, has a pulse oximetry reading of 92%. Which action is required? A. Encourage deep breathing. B. Notify the provider immediately. Commander. Administer supplemental oxygen. D. Monitor for fever. Correct answer. B. Notify the provider immediately. Explanation. A pulse oximetry reading below 94% indicates hypoxia, which requires immediate medical attention to prevent further deterioration. Question 7. A nurse is performing a dressing change on a below-the-knee amputation, BKA stump. Which action is inappropriate? A. Use a non-stick dressing. B. Lower the stump during the dressing change. C. Wrap the stump when elevated. D. Tape the dressing to the skin. Correct answer. B. Lower the stump during the dressing change. Explanation. The stump should remain elevated during dressing changes to prevent edema and promote healing. Lowering it can cause blood pooling and swelling. Question 8. A client diagnosed with choledocholithiasis asks where the stones are located. The nurse explains they are in the A. Kidney, B. Common bile duct, C. Gallbladder, D. Salivary gland. Correct answer. B. Common bile duct. Explanation. Choledocholithiasis refers to the presence of stones in the common bile duct, which can obstruct bile flow and cause complications. Question 9. A client returning from a lake vacation has a red, swollen, and painful ear canal. Which finding indicates otitis externa? A. Tinnitus. B. Foul-smelling pus. C. Vertigo. D. Hearing loss. Correct answer. B. Foul-smelling pus. Explanation. Otitis externa, commonly known as swimmer's ear, is characterized by inflammation and infection of the outer ear canal, often accompanied by foul-smelling discharge. Question 10. A patient admitted after a motor vehicle accident has abdominal injuries and a broken femur. Vital signs include tachycardia, tachypnea, and hypotension. What type of shock is suspected? A. Septic shock. B. Hypovolemic shock. C. Neurogenic shock. D. Cardiogenic shock. Correct answer. B. Hypovolemic shock. Explanation. Hypovolemic shock results from significant blood or fluid loss, which is likely in this case due to abdominal injuries and a fractured femur. Question 11. A nurse provides post-op instructions to a client after a vasectomy. Which statement indicates the client understands the instructions? A. I should avoid showering for a week. B. I need to use another birth control method for a while. C. I can resume sexual activity immediately. D. I will not need to follow up with my provider. Correct answer. B. I need to use another birth control method for a while. Explanation. After a vasectomy, sperm may remain in the semen for several weeks. Another form of contraception should be used until a sperm count confirms sterility. Question 12. A client with empyema develops shortness of breath after returning to bed. What is the nurse's best action? A. Place the client in a supine position. B. Encourage pursed lip breathing. C. Administer a bronchodilator. D. Provide a paper bag for breathing. Correct answer. B. Encourage pursed lip breathing. Explanation. Pursed lip breathing helps maintain airway pressure and improves oxygenation, which is beneficial for clients with respiratory distress. Question 13. A client with cirrhosis develops ascites. What is the primary cause? A. Portal hypertension. B. Decreased albumin production. C. Renal dysfunction. D. Electric. Correct answer. B. Decreased albumin production. Explanation. In cirrhosis, the liver's ability to produce albumin is impaired, leading to decreased oncotic pressure and fluid accumulation in the peritoneal cavity. Ascites. Question 14. An 11-month-old girl scheduled for surgery to correct tetralogy of Fallot has a hematocrit of 63%. What does this indicate? A. Anemia. B. Polycythemia. C. Infection. D. Dehydration. Correct answer. B. Polycythemia. Explanation. A hematocrit of 63% is elevated, indicating polycythemia, which is common in cyanotic heart defects like tetralogy of Fallot due to chronic hypoxia. The question 15. A wound care nurse observes pink granulation tissue in a stasis ulcer. What does this indicate? A. The wound is infected. B. Healing is taking place. C. The wound is worsening. D. The wound needs debridement. Correct answer. B. Healing is taking place. Explanation. Pink granulation tissue is a sign of healthy wound healing, indicating that new tissue is forming. Question 16. A client feels lightheaded when standing after sitting for a long time. How should the nurse assess for orthostatic hypotension? A. Ask about dizziness. B. Take blood pressure while lying, sitting, and standing. Check the client's heart rate. D. Monitor oxygen saturation. Correct answer. B. Take blood pressure while lying, sitting, and standing. Explanation. Orthostatic hypotension is diagnosed by a significant drop in blood pressure, greater than or equal to 20 millimeters of mercury systolic or greater than or equal to 10 millimeters of mercury diastolic upon standing. Question 17. After a client's lung resection, the hourly chest tube output is 300 milliliters. What is the priority action? A. Turn the client. B. Notify the physician. C. Milk the chest tube. D. Slow the IV infusion. Correct answer. B. Notify the physician. Explanation. An output of 300 milliliters per hour is excessive and may indicate hemorrhage, requiring immediate medical attention. Question 18. A client with type 1 diabetes and gastroenteritis asks how to prevent dehydration. What should the nurse advise? A. Drink only water. B. Drink 8 to 10 ounces of fluids every hour while awake. C. Avoid all fluids until vomiting stops. D. Resume a normal diet immediately. The correct answer? B. Drink 8 to 10 ounces of fluids every hour while awake. Explanation. Frequent fluid intake helps prevent dehydration, which is critical for clients with diabetes to avoid complications like diabetic ketoacidosis, DKA. Question 19. Scenario. A 60-year-old female with chest pain is placed on O2 at 2 liters per minute. Which finding requires immediate action? A. Fatigue. B. Restlessness and apprehension. C. Nausea and indigestion. D. History of hypertension. Correct answer. B. Restlessness and apprehension. Explanation. Restlessness and apprehension are signs of hypoxia, which requires immediate intervention to ensure adequate oxygenation. Question 20. A nurse instructs a client on caring for a Jackson Pratt JP drain at home. What should the nurse include? A. Empty the bulb when it is full. B. Milk the tubing to move clots to the bulb. C. Avoid showering until the drain is removed. D. Record the drainage amount weekly. Correct answer. B. Milk the tubing to move clots to the bulb. Explanation. Milking the tubing helps maintain proper drainage by preventing clot formation and ensuring the system functions effectively. Question 21. A nurse finds a client unresponsive and not breathing. What is the next action after calling for help? A. Provide rescue breaths. B. Check for a carotid pulse. C. Start chest compressions. D. Administer epinephrine. Correct answer. B. Check for a carotid pulse. Explanation. After calling for help, the nurse should check for a pulse for no more than 10 seconds. If no pulse is detected, CPR should be initiated. Question 22. A client with an acute asthma attack has high-pitched wheezes during exhalation. What does this indicate? A. The client is hyperventilating. B. The airway obstruction has worsened. C. The client needs suctioning. D. The client is improving. Correct answer. B. The airway obstruction has worsened. Explanation. High-pitched wheezes during exhalation indicate severe airway narrowing, requiring immediate intervention to relieve the obstruction. Question 23. A 9-month-old infant is irritable and lethargic with poor skin turgor and tachycardia. What should the nurse ask the parents? A. Has the baby been vomiting? B. How many wet diapers has the baby had in the last 24 hours? C. Is the baby eating normally? D. Does the baby have a fever? Correct answer, B. How many wet diapers has the baby had in the last 24 hours? Explanation. The number of wet diapers helps assess hydration status. A decrease in wet diapers indicates dehydration, which is a priority concern. Question 24. A patient with pancreatic cancer undergoes a Whipple procedure. What is removed during this surgery? A. Entire pancreas. B. Pancreas head and gallbladder. C. Stomach and spleen. D. Liver and gallbladder. Correct answer? B. Pancreas head and gallbladder. Explanation. The Whipple procedure involves removing the head of the pancreas, the gallbladder, part of the stomach, and the duodenum to treat pancreatic cancer. Question 25. A client with end-stage renal disease, ESRD, begins peritoneal dialysis. Why is the dialysate warmed before infusion? A. To promote vasodilation. B. To increase comfort. C. To decrease the chance of infection. D. To improve toxin removal. B. To increase comfort. Explanation. Warming the dialysate to body temperature enhances patient comfort during peritoneal dialysis, reducing the risk of cramping and discomfort. Great job making it through all 25 questions. We hope this practice test helped you feel more confident and prepared for the NCLEX. Remember, the key to success is consistent practice and understanding the reasoning behind each answer. If you found this video helpful, don't forget to give it a thumbs up, subscribe to our channel for more NCLEX prep content, and hit the notification bell so you never miss an update. If you have any questions or want us to cover specific topics in future videos, leave a comment below. We'd love to hear from you. Keep studying, stay focused, and remember, you've got this. Good luck on your NCLEX journey, and we'll see you in the next video. Until then, happy studying!